Well, speaking of aging, I wanted to ask you about sleep across the lifespan. So, again, from experience, we know that sleep obviously changes across the lifespan. Newborn babies sleep all the time, more or less, most of the day. And as we get older, we sleep less. And many of us will know that, our grandparents tend to sleep less in a given day than we do. Sleep quality also often changes as we age. In general, people report that their sleep quality seems to decrease as they get older. Can you talk a little bit about how sleep quality and sleep architecture change throughout the lifespan? And I want to maybe differentiate between developmental changes that are sort of supposed to happen or pre-programmed versus dysregulation that happens due to aging or accumulated damage or something like that.
Yeah, no, that's a great question. So, yeah, it's certain that the sleep architecture changes throughout lifespan, and we all know, of course, that infants sleep most of the day. They are essentially growing their brain, myelinating their synapses. There's a whole, really, as you mentioned, a developmental aspect of it that is for which sleep is essential. And as we reach adolescence, then sleep becomes more and more important to either just brain development or memory consolidation as it goes. But of course, at a certain age, yes, there's an accumulation of, as mentioned, metabolic and other also genetic errors that result in what I would say, disruption of sleep architecture, mostly due to sleep fragmentation. So it's not that older people sleep more, and they do tend to sleep more, but also it's their sleep becomes disrupted, and therefore, the sense of a recovery from sleep